Hi, my name is Dr. Rob Sheely, and I want to welcome you and thank you for taking the time to look at this DVD. The purpose of this is to give you kind of an inside look at some of the systems and procedures we use in taking care of patients. And I'm going to walk you through some of these procedures so that you get a better understanding. Maybe you'll feel like you've been here even though maybe you haven't been here in the office. Again, welcome. Thanks for being here with me. It's actually pretty exciting to me. We've been told we have the most accurate and detailed documentation people have ever seen. Many attorneys and medical doctors have told us this. We do a lot of personal injury and workers' compensation cases, and we use these objective tests. One of them is the algometer instrument. It's an objective measurement of the level of pain that the patient perceives. That's a pressure-sensitive device that records the levels, and we're able to put this into a graphed report and also into the documentation in the daily notes for the patient. Another test that we do is a spinal analysis machine. It's a postural device that actually measures and checks the posture of the patient, and it is measurable. So if it's measurable, it's graphable, so we can produce a report for that so that it is comparable later after we've treated the patient. Of course, those findings go in the daily notes. We also use a digital blood pressure and pulse measurement device. Again, that makes it highly repeatable, very reliable. And if we have any question, we do it manually, of course, but this device gets about 90% of the cases. We use a dynamometer device. It's an objective hand strength measurement test. Many times patients might have pain in their arm, and we do a screening to see if there might be a muscle weakness, which could be indications of other underlying problems. We use a body fat composition, body mass index device. It's a good health screening for patients to see just what level of overall health they're in. It's a good measurement so they can compare for themselves what direction they'd like to go. The thermometer is a device that is a measurement of what we call paraspinal temperature on either side of the spine, and it shows whether it's even or pulled to the right or to the left, and we can graph that as an objective finding and again place the documentation for that in the patient's daily notes. The microfet muscle testing device is an objective muscle test strength device. Very helpful. We use this bilaterally and compare one side to the other and to see if the strength fits within a normal range. Normally you should have 10 to 15% difference on the dominant side. This is produced in a report, and also the documentation is placed in the notes for the patient. We do eye, ears, nose, throat screening on every patient. It's kind of surprising for a lot of patients and other practitioners, but we do a lot of screening and find out things that need to be screened and found out for the health of the patient. The digital inclinometer is a range of motion device. We call it's a dualer because there's two inclinometers with this. Very accurate, very repeatable because it's in a digital format. This is produced into a graph that can be compared from one date to the next to show improvement. Objective testing for a neurological examination is done on every patient. We find a lot of things that others may not find if the testing isn't done. We're very detailed and make it clear in the documentation what things have been done and what things are normal, abnormal. We actually use the tape measure too. It's an old device, but it's a very accurate device to determine whether there's any muscle wasting or muscle weaknesses that have gone undetected. We do have a 24-hour answering service. Not a live person, but you can leave a message and we get right back to you on the next day. Front desk, of course, answers the phone. This is a depiction of a new patient coming in. They help fill out the paperwork for the new patient. welcome the patient back into the office. We've got a great staff. The patient is instructed on where everything is in the office. I get in and we get a consultation done. We find the most important parts that the patient's here for. We also have different therapies within the office. Once we've done the exam, and if x-rays are needed, we give them the report, and that shows a treatment, a spinal adjustment, just one of the things that we do here in the office. We also check range of motion as we test. We also do many therapies. That's a hot pack electrical muscle stim shown there. We go over the insurance benefits if you have them, and make sure that you have a full understanding in the office before you actually treat. And just a little levity if you can stand it. In my mind, there's nothing like a little humor that makes you remember something important.
For millions of years, millions.
This honestly is my favorite one.